Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us today. We're here with you again for our weekly press conference on Delaware's response to COVID-19 pandemic. We're joined, as we normally are, each week by Dr. Kyle Rattay, who's the Director of the Division of Public Health. Always a special thank you to her and her team who continue to do an outstanding work in responding to the virus. Presenting us with the science necessary to make thoughtful decisions and operationally doing testing and vaccination and working with special populations and workers, essential workers across our state. AJ Shaw is with us again today, the Director of Delaware Emergency Management Agency. Thank you again to AJ for joining us and for all your work as point person for both the testing program and our partners there, our vaccination clinics, and our partners there working hand in glove with DPH, with our National Guard, men and women who've, by the way, been doing an outstanding job on assignment there with the National Guard, our partners with the Division of Public Health, obviously Dover Speedway, our partners, Curative and Vault, and others at the local community level, churches, community organizations, and those helping Lisa Henry and her team at Public Health get vaccinations to vulnerable populations, people of color across our state. Our goal from the beginning has been fast and fair. We have some good and exciting news today and also some words of caution. We're making incredible progress getting vaccines into people's arms across our state. If you look at the data county by county, the percentage of vaccines being delivered in Sussex County is kind of leading the way, with Newcastle County and Kent County just behind, and we're going to kind of make it a race to the end, a competitive race to get as many people and a percentage of populations vaccinated as possible. As I mentioned, Dover Down, special thanks to the Dover Speedway for allowing us to use that as a vaccination clinic. We did 10,000 or thereabouts over the weekend, and about 5,000 per day, which is a really great way to get shots into people's arms. We're making real progress. As I said, 30% of eligible Delawareans, essentially adult Delawareans, have been received at least one dose of vaccine. Really making progress on those essential workers for essential businesses, 28,000 over the last week or so, including frontline restaurant and bar workers, runs the gamut, those who work for municipal governments, our partners there, and other employers across our state. We've also been focusing on 50 and older, 25,000 people 50 and older, including yours truly, signed up to be vaccinated. We sent out 10,000 invitations to our clinic at Dover Downs, 5,000 took those appointments. I was one of them. My wife Tracy and I got vaccinated over the weekend, and it was smooth as ice, really very well done. Again, thanks to our partners at Public Health, the Speedway, AJ's team, Dr. Rattay's team, and importantly, our Army and Air National Guard. We're also focusing through hospitals and primary care physicians on people with pre-existing health conditions. So if you are in that category, make sure you contact your primary care physician, the local hospital, your healthcare providers. The pharmacies are getting increased supply from the federal government. It's important to recognize that those are vaccines that the State Division of Public Health, our team, doesn't control the allocation or when how they're delivered, when they're delivered to Delawareans. But be mindful of the fact, if you go onto our website, you can see where pharmacies are that have vaccine appointments necessary. So all of this, we're seeing kind of an increase in allocation, pretty big increase in our supply from the federal government, including the number of the thousands that are going to the pharmacies. And we're putting out more and more. We have to put out and offer more and more invitations for people to fill up the appointments that we have at our large vaccination centers, at the campuses of Del Tech in the 3 counties and at Dover Downs. And so as of April the 6th, we'll be opening registration for all eligible Delawareans for the COVID-19 vaccine. This is an important milestone for us. It will help us meet our dual objectives of fast and fair. We have considerable effort in vulnerable communities, communities of color, to take vaccination clinics to those neighborhoods and communities through trusted partners. I have visited a number of those sites, and they are very effective getting the word out and getting shots into people's arms. This opening up of our registration list doesn't mean you'll have an appointment ready the next day, but you'll be on the list to be offered appointments across our state closer to where you live. This is in advance of President Biden's directive that all states open up to all eligible citizens, all eligible residents of the states, access to vaccinations by May the 1st. So we're moving that up, those registrations, by April the 6th. Well, this really good work and optimistic, these optimistic things are happening in our state. We're still seeing now some concerns and an uptick in the number of positive cases that we see on a daily basis, a 7-day moving average. You can see it here at the data update, where we were down under 200 new cases per day in the 7-day moving average. You can see we're over 280 now again, and we were under 5% positive. We're still testing at a very high rate. Some of those additional cases on various days are because of still very high testing availability, but you can see that the percent positive now is right there at 5%. Our target, World Health Organization target, is to be under 5%, and we're headed in the wrong direction there. We had been under 100 hospitalizations a couple weeks back. Now we're up to 134. We do get some pretty good reports from the hospitals just yesterday, but some concern with some hospitalizations, a little bit younger population. Obviously, when 2/3 of your seniors are protected, have protective vaccines against hospitalizations and death, you should see a smaller number there, and we are seeing that. Sadly, again, almost 1,600 lives lost in our state, friends and families, everyone. We continue to test vigorously, and we would encourage people to continue to get tested, particularly if you are planning to move around. It's very obvious that people are getting spring fever. There's a lot more traffic out on the road. You see more people in public spaces. Make sure you're wearing your mask. Make sure you're keeping your distance and just being careful in gatherings, washing your hands and sanitizing your hands. Most retail establishments have sanitation there at the doors and entrances and exits. Make yourself available to them. So over 1.5 million tests administered, AJ, really tremendous work. We're still doing about 35,000 a week. It's 140,000 a month, still considerably above the 80,000 target that we had so many months ago. So this shows the picture of the last year with the surge in new cases as we first experienced COVID-19 on March, the first case on March the 11th, and we saw our peak in hospitalizations. They are back late April, mid-April, April the 17th at 337. And then the second surge that we've just survived, that started just around Halloween and the Thanksgiving, the December holidays. We peaked up early in January at 474 hospitalizations. Made steady progress down the backside of that curve with hospitalizations just under 100. And then as I've said, over the last couple of weeks, our hospitalization number has ticked up by 35% to 134. Obviously some concern, considerable concern there. Essentially what we need people to do is just be a little bit more, a little less complacent, a little bit more compliant. Wear your mask, be careful. We need to get through this as people get vaccinated. We're well on our way with over 500,000 vaccines delivered to our state, almost 500,000 administered. Here's new positive cases. You can see the most recent surge that we've had starting in November, late October, November, December, January, much larger than back in March, but we're doing 2 or 3 times the number of tests over that November, December, January period of time. You can see there at the end, the far right, new positive cases have ticked up, and we don't want to see another peak after that, a third peak. That would be devastating for us. So we need folks to lean in just a little while longer as we get people vaccinated. Wear that mask. It's a small sacrifice to make in order to protect your family and friends, and importantly, businesses that need to get back into closer to full operation, particularly hospitality. All right, here's some numbers that I've mentioned in terms of the delivery of vaccines to our state. Almost 450,000 delivered to the state, another 100,000+ delivered directly to the pharmacies for their nursing home program and the most recent equity program. So well over 500,000. We're almost to 500,000 administered, and then another 100,000. We just got 25,000 delivered yesterday. Obviously, that's in this number, and a significant number delivered recently to the pharmacies. Again, they're on their way, finding their way to people's arms. So we've got 100,000 coming that are in the state, and others on their way as we move to get those populations vaccinated. Again, as I said earlier, over 30% of Delawareans have received at least one shot, and that's a really good thing. We do have Johnson & Johnson one-shot vaccination coming this week, and they will be increasing that supply in the weeks ahead. The breakdown of fully vaccinated, you can see here, almost 100,000 of our seniors 65 and older have been fully vaccinated and therefore protected from serious illness, hospitalization, and death. And that's a really positive thing. Reduces anxiety for all of us, particularly those that are in that age category. Under 65, again, making progress with 62,000 Delawareans fully vaccinated. These are the percentages: 78% for seniors, 35% age 16 and up. And again, we're moving on April the 6th to making available registration for COVID-19 vaccines to all Delawareans that are eligible. That means 16 years and up. Because of the improvements that we've seen over the last several weeks, despite some of the fallbacks on number of cases, we, starting April the 1st, will be loosening restrictions for outdoor gatherings. We've got spring and summer coming. A lot of those outdoor gatherings occurring or in the planning stages. This still does not allow untethered outdoor gatherings, but a move to recognize that outdoor gathering is much less risky than indoor gathering, and something that we all need to keep in mind as we all start moving around. We've had tremendous vaccination events. Here's some photographs of my wife Tracy and I getting our vaccinations at Tracy last Saturday at Dover International Speedway, and I got mine on Sunday. Dover International Speedway, I would encourage all of you as you get registered, first of all, to register. It's much easier to get you an appointment if you're on one of our registration lists, get you to one of our vaccination sites. If you're on that list, also contact your local pharmacy to get on those lists as well, and to take whatever vaccine is available and offered to you when it is. That's a really important one. I did visit, as I said, some of the local community vaccination sites at churches and community centers. This is one in Bear that I visited on Saturday. A couple hundred folks in that Bear area community that were able to get vaccinated at that site. So we're making real progress, getting getting vaccines into Delawareans' arm fast and fair. AJ and his team, Dr. Rattay and their team at Public Health, working together, working with our Army and Air National Guard, working with our first responders. Can't forget the county paramedics who are out there delivering vaccines, our Medical Reserve Corps, the Lieutenant Governor, Hall Long and her crew, making sure that we're getting vaccines fast and fair into Delawareans' arms. Thanks for joining us today. Now we have Dr. Cara Rattay for her report.
Great. Thank you so much, Governor. Great to be here. And overall, good news, really exciting, the progress that we as a state are making with vaccination. But before I do talk about areas of concerns, I do want to reemphasize what the governor mentioned about cases, that we are seeing a general rise in the case rates around the states, and not just in some areas. So overall, about a 20% increase in cases per capita in our states. So there is reason to remain cautious and to just be patient as we're getting more people vaccinated. As we look at our map of Delaware and our areas of concern, we have now increased to 9 zip codes, which are areas of concern. Still looking at Newark, 19717, 19716. We had 64 UD student cases in the last week. So it's better than it was weeks ago, but we still have some infectious spread brewing in the Newark student population. Additionally, on our map today, we have Millville in Sussex, as well as Townsend, Middletown, Delaware City, Newcastle, and in Wilmington, 19801 and 19805. So, it really is important that that we don't let our guard down at this point, as we are seeing some slight increases. And I want to shift a little to talk about variants, which may be driving a little bit of this increase that we are seeing. So we have been sequencing in our lab positive cases for variants for about 8 weeks or so. So at this point now, we have tested 1,152 positive specimen. They're samples of positive cases, samples that go through our lab, as well as from the hospitals and the University of Delaware. So we're looking at these samples to see what kind of variants we see. We've talked about before that we've seen the UK variant, which is a variant of concern. We've seen 17 of those cases. We've only seen one of the South African variant, which is good because that is the one that is more contagious and more serious. But we also have seen several of the California variants, and also now that we're testing for these variants of concern, we've seen a number of the New York variants as well, which isn't surprising. These variants are increasing significantly in the New York, New Jersey, Connecticut, Rhode Island, Massachusetts area. Again, we're going to keep a really close eye on these. Of the specimen that we have tested, about 4% of them have been positive for these different variants so far. We do expect that number to go up. So again, you're going to keep hearing us emphasize the importance of mask wearing and not gathering. If you're going to be around people, please try to do it outside. Those messages that we have been talking about for so long, they remain so true. And again, the mask wearing, a mask that fits snugly around your mouth and nose, especially when you're around other individuals, really is the key to staying safe while we get through this time. So as the governor talked about, we are really excited to move forward with our vaccination program. Medical providers, private providers, hospitals throughout our states, primary care, specialty providers have been vaccinating their patients, and they're doing an outstanding job, by the way. These are some of our best providers as far as getting vaccine into the arms of Delawareans as quickly as possible. They're really focused on at-risk patients, so patients 16 and up who have a pre-existing condition that puts them at higher risk for COVID consequences. So we're really grateful to them for serving in this role. We do know that there are still folks out there that are looking for vaccines. And so we're asking our healthcare community to continue to stay focused on vaccinating at-risk individuals, those with those chronic underlying conditions that put them at risk, while we open up more so in other areas. So with pharmacies, we are soon going to be allowing anybody 16 and up, regardless of health condition, to be able to be vaccinated in pharmacies. Let me emphasize one little point here. 2 of our vaccines, Moderna and Johnson & Johnson, are for 18 and up. So for those 16 and 17-year-olds out there, Pfizer is the only vaccine that you can use. So if you are looking for a vaccine and you're finding an appointment and you're 16 or 17, make sure it's Pfizer that you are finding. But we are excited to really open access for Delawareans 16 and up in pharmacies. And additionally, with our state-run programs, we have been focused on the 50 plus. Last week, we opened our wait list, got about 25,000 people on our wait list, and we began vaccinating individuals at the Dover International Speedway this past weekend, as well as curative clinics this week, which equals about 8,000 opportunities. So lots of folks in that 50 to 64 category are now getting vaccinated, which is great. Additionally, we vaccinated about 5,000 workers at Dover International Speedway this past weekend as well. So as the governor mentioned, we're still focused and we'll continue to focus on those frontline and essential workers. But again, as we move forward for our wait list, we're going to start taking names for all individuals who are age 16 and up. Now, we will continue to continue to use a methodology where we're identifying people by risk. So, numbers of chronic condition, age, etc., to prioritize those at higher risk on our wait list. So if you're a healthy 20-year-old, please do get on our wait list when we open it up next week at request vaccine vaccine request at delaware.gov. But we will be prioritizing through our wait list. So we'll continue to focus on those with chronic conditions and those who are older in our wait list. We also have very focused efforts to support people with disabilities. We talked a little bit about this last week. I want to give a huge shout out to a DHSS work group led by Secretary Molly McGarrick and a number of other amazing experts in our department who have begun vaccination events for those, especially those with developmental disabilities, but broader groups such as those with severe and persistent mental health disabilities as well have been able to access vaccine through these events. So these have really gone fantastic. For those with disabilities who are having difficulty finding vaccine, or for those who need an accommodation, we have more information now on our website than we did last week. So check out our website, the disability section, but you also can shoot us an email and let us know if you're having trouble finding your vaccine at vaccine@delaware.gov. And we also continue to reach out to underserved communities, and we are going to continue for quite some time to stay focused on persons of color who aren't either able to access or who aren't accessing some of these big vaccination events. We have really found a lot of success in working with partners throughout the state to vaccinate individuals. This upcoming week, we have 14 community-based events around the state, not quite as much because of the holiday weekend coming up, and churches in our state have been tremendous partners. They're kind of busy in this upcoming week. but we're going to continue those efforts. With those community events, we've vaccinated over 6,000 people already. 45% are persons of color. In our DPH clinics, we've vaccinated almost 3,000 people. About 30% are persons of color. In our state service center clinics, we've vaccinated almost 2,000 people, and more than 30% are persons of color. So it's very important as we open up wider that we also continue these very strategic and targeted events. And while we all know that often when we do open up, and we saw this in January, that we're not where we want to be as far as vaccinating being proportional to the share of the population among people of color. But within those groups of people of color who are 65 plus, what we were able to see is that we gained significant ground in that those within our minority groups were getting vaccinations faster than white residents in the last month or so. So we've been able to see through our data that these concerted and more smaller events do make a difference. Finally, I just want to provide a little bit of an update on new CDC guidance that came out yesterday, looking at health risks, or who is at greatest risk for health consequences from COVID. You may recall that we previously, when we had phases, there was a 1C that had the highest risk, and there was a phase 2 that was moderate risk. We in Delaware, several weeks ago, we collapsed those lists. CDC has done the same thing as of yesterday. So you'll no longer see a high risk or moderate risk list, but it's really all one risk that we're considering high risk. And really what the CDC has done is not significantly different than what we have done, with the exception of a couple of things. They added substance use disorder to the list of risk conditions, which we very much agree with, based on newest science that shows those with substance use disorder who developed COVID-19 were 1.8 times more likely to be hospitalized, almost 1.5 times more likely to need a ventilator to breathe, and 1.3 times more likely to die than those without a substance use disorder. Additionally, they added sickle cell disease and several pulmonary, interstitial pulmonary disease, as well as pulmonary hypertension to the list. And so we have done the same. So you will see on our website those updates that are now aligned with CDC. Additionally, we felt it was very important to add disabilities to our list, developmental disabilities, as well as mental health disabilities and physical disabilities are on our list as well. That is it for me. So I'm going to hand it back to the governor. Thank you.
Thank you very much, Dr. Rattay, for detailing all those efforts to get vaccines to Delawareans in a way that's fast and fair, trying to match the supply we're getting from the federal government with our partners, physician offices, healthcare providers, hospital systems. And by the way, the hospital system's doing a really good job vaccinating those with those pre-existing health conditions, and Christiana Care in particular, reaching out to homebound populations, others that are more vulnerable. All the efforts to get vaccines to those that are intellectually, physically disabled. We appreciate those efforts, challenging, as well as populations of those essential workers through our clinics. What I would say to everyone is that all of this is a lot easier to do if people are signed up on a registration list. It's easier to do, obviously, if you're a pharmacy, if you're registered at your local pharmacy. The same is true at your primary care physician. So take the opportunity and the time to sign up onto the state registration list. Now, as of April the 6th, next Tuesday, it'll be open to all eligible Delawareans. And when you get that email, inviting you to a clinic, take the first vaccine opportunity that's available to you. We've been told by the public health officials since the beginning that we're going to get from whatever the point that was till the point where we all get vaccinated through mask wearing, social distancing. Now we're going to get to the end. The light at the tunnel is getting brighter by getting everybody vaccinated. Those numbers are ramping up, and we have to keep the supply moving, which is the main reason we're moving to opening up our registration lists on April the 6th. We're going to call him Dr. AJ Shaw. We're going to give you a PhD in public health after this. AJ, thanks for your great work and that of your team.
As I said before, if you saw my science grades in high school, nobody would be calling me doctor. So good afternoon, everybody. Going to start off with testing again, and I think the governor hit some of this as we started, but we have seen, and I think you've reported now for 4 weeks straight, a small decline in more or less we're off of the the highlighted weeks of 50,000 plus that we were doing back around the holidays, but it's not just here, it's around the country, and it's important. The governor said, Dr. Tays highlighted of how we've had excellent progress on the vaccination efforts, but the testing is still very important to make sure we could isolate individuals and keep them from spreading it more. I know everybody has cabin fever. We've heard traffic's up more than ever before. We had a call with the mayors across the state this morning, and they said, beach traffic is back to normal levels, and it's still only March. So, this is just remember a year ago. A year ago we weren't doing 5,000 tests in a week, and now we have the ability to do 5,000 tests in a day. So the capacity is still out there. And we're asking everybody to stay vigilant a little bit longer. We're opening up the groups and those eligible next week. And, we'll hopefully have better days in the summer ahead of us. So as I get into the testing numbers, I say that and I beg it and I stress the importance of it, and it still matters. But we also did see a slight increase last week as well. So that's kudos to everybody. We have ample opportunities, whether it's the static sites in the clinics, the state, the mobile sites, the pop-up sites that we do with Curative, the at-home option that's on the website, in addition to other clinics that are doing this, where we're able to handle any spring break travelers or people like that if they are traveling or they're going home from a Institute of Higher Learning to their home and coming back, please get tested. We have that capability. We're not pulling it back by any means, but we have seen demand drop a little bit over 1,700 tick up last week, which is great. But we're hoping to have numbers back in the 40,000 over the next few weeks, as we know people are going to start moving more in the springtime. We have the flyers at de.gov/get tested. So again, easy layout of the static sites, the pop-up sites, and then if you want to do the at-home option. So de.gov/get tested for all that information is posted early each week. Going over to the vaccination effort, so last week, I know we got a lot of questions when we said we were doing a walk-up model. It was actually an on-site registration model that we do with Curative. We used some partners in Wilmington to hand out vouchers. We had about 96% show-up rate, which is awesome. So that means, 240 some people that got those cards showed up to the site to get vaccinated, and they registered on site. So the throughput slows down a little bit, which impacts operations over the course of the day, but also it bridges the gap of people that are unable to register online, unable to register for the state system, et cetera. We're also working with Walmart, great partners who saw an increase in their federal pharmacy supply come into the state and wanted to see how they could help out by hosting a pod. So we're going to be working with them over the next several days to set something up. And likewise with Rite Aid. Rite Aid saw a bump in their numbers, and they've been working with Dr. Pescatore and Lisa Henry's team to see where the greatest need was. So we do have more vaccine coming into the state. It's important for us to be strategic to make sure we look at those areas that are maybe those vaccination deserts or don't have the opportunities others do, and develop ways to address that. And then finally, kind of what we're working on for Dover Speedway again this weekend. I know the governor said we have, till the end of April. Actually, the first weekend in May will be our last few days there. Really great partners there, allowing us to, go right up to the build out of when they'll be getting ready for the races. So this weekend, we'll be doing about 8,000 second doses of individuals that got their vaccination, I believe it was March 8th and 9th. We'll do about 5,000 essential workers on Friday. And then between Saturday, and there's nothing Sunday because of the holiday, but then Tuesday, so the 2nd, and I believe it's the 4th, we'll be doing just about 3,000 individuals from the 50 and up list. Everybody, as of yesterday morning, there's 25,000 people in the state that signed up to the state website to register for the 50 and older wait list. We anticipate that everybody, as of yesterday, unless that number increases more, those 25,000, about half of them have already received an invite, and some took advantage of it this weekend or through events this week. But by this time next week, everybody on that website or that registered will have received an invitation from the state. And then that works perfectly. It does opening it up to everybody over 16 to be able to register, so then we could keep this demand going, fill the spots as quickly as possible. And like I said, see the light at the end of the tunnel and have a great summer. So Governor, back to you.
That's it, AJ, right there in a nutshell. We've got vaccine invitations going out to everyone on that registration list. Next week, April the 6th, we're opening up those lists to all eligible Delawareans. Take the first invitation that you can get, make it work. We need to match the supply or the demand with the supply. As AJ alluded to, demand is softening up a little bit. We do fill up all the slots, but it takes us a lot more invitations. You heard him talk about the 50 and older group at Dover Down Speedway, where we put out twice as many invitations as we had folks that took those appointments. I was lucky to be one of them. Let me just tell you, it's a great feeling to get that first dose. It's been an incredible year, very difficult year. It's certainly, if you compare it to a foot race, it's certainly a marathon, not a middle distance, and certainly not a sprint. To extend the analogy, we're in the last couple miles of that marathon. We need to run through hard. We need to run through the finish line. And to do that, we need to do the things that we were instructed to do from the beginning. Keep social distancing, sanitize your hands, and most importantly of all, wear that mask. It's a small sacrifice to make sure that your favorite restaurant can get back to business with full capacity, to make sure that those who are out of work can go back to work as a result of the shutdowns. We're getting there. We've done what we've needed to do. We just need to continue to get people vaccinated. So take that appointment when it's available. Register. It's so much easier for us to get you an appointment if you're on our list than it is if you're not on our list. Kudos and thanks to everybody working on those community clinics, taking vaccine to vulnerable populations. Special thanks to those of you working with us on those with physical and developmental intellectual disabilities. There's a special place in heaven for all of you. And I think that's it. We've got media here, and we're open to their questions.
All right, first we'll go to Amy Cherry with WDEL.
Hi, everyone. Thanks so much. I'm wondering how prepared you feel for the surge of demand that you're going to see when these vaccinations open up to Delawareans ages 16 and older, and how long you expect it to take to actually be able to vaccinate everyone that will sign up.
Yeah, that's a great question. And that's why registration is so important. We will direct people to those appointments through the list. And as you can see, as you've heard us, AJ and I, Dr. Rattay, have all said that when you're on that list, it's taken us longer to fill up a clinic from those lists, but we're not going to be able to meet the demand immediately. I think it's fair to say, AJ, that with respect to those 50 and older, we expected to have more than we did, and that we expected to have a more intense level of demand. It was pretty frenetic back in December and January when we were doing 1A, and those 65 and older, obviously they were both people on the front lines exposed to those with COVID-19, as well as seniors, most vulnerable. AJ, what your thoughts on that?
Yeah, the only other thing I would say is, I think Amy is that we have to look at is we're doing the 50 and older, and then we've also done, tens of thousands of essential employees as well. So we're taking them from both sides of both these lists, right? Some people are getting invited through the employers, some are getting invited through the 50 and older list. So, I think once we see what we get signed up next week, we can look at what our allocation is from our federal partners. We know our federal pharmacies are getting a little bit more as well. Then we could possibly come up with some run rates and see how many we think we could do a week and how we, dig ourselves out of this hole and get everybody done that's interested. A lot of outreach is still going on with Dr. Tay's team to make sure we get into communities that need the education outreach or comfort really with it. So it's, it's a difficult question to answer because we don't know what the population is that's raising their hand saying, I want a shot today.
And Amy, an important consideration as well was our partners in the pharmacies, in the hospitals and others, it's more difficult for them to suss out who's eligible when you put boundaries around it, right? So it's in part in response to taking friction out of that process so they can move people through more quickly.
Second question, next week, indoor dining will rise in Pennsylvania to 75% capacity. In Maryland, there are no restrictions. Why do restaurants and bars here remain limited at 50% capacity for indoor dining? And what do you need to see to get them back up to at least that 60% point they were at one point during the pandemic?
Yeah, when you think about it, what you just said isn't true. In Maryland, there are restrictions. They have distancing, mask wearing, and et cetera. I talked to Governor Hogan.
Sure, capacity, sorry.
Oh, no, that's important. And I don't mean to be flip about it, but it's important because our restaurants with those limitations, geometric limitations, if you will, keeping tables separate, limiting people that are at tables, et cetera, that limits capacity on its own. The question is whether you have a fire code capacity limit on top of that. Maryland does not have that. I talked to Governor Hogan directly about it. He agreed with me that those limitations of spacing and others within an establishment effectively limit the capacity to around 50% anyway. So it really is a question there of kind of your attitude towards it. Are you more cautious or less? And right now we need to be a little bit more cautious with indoor gatherings. With respect to Pennsylvania, you mentioned 75%. Practically speaking, you probably can't do 75% and keep those other restrictions internally in a restaurant. One of the things that we have, and I think they have it as well, and it'll increasingly be relevant, is outdoor dining. We talked about it on the mayor's call this morning. Each of those mayors in Lewis and Rehoboth and other places were talking about their restaurants eager to start moving tables outside.
All right, next we'll go to Tim Mastro with Delaware State News.
Hi, everyone. Good afternoon. I want to follow up with AJ on the Dover International Speedway site. I know you're going to have to take it down for when NASCAR comes. Are there plans to have a site like that anywhere else in the state? Are there plans to reset it up after NASCAR leaves town?
So, Tim, I think I'll answer your second question first. I don't think we're going to reset it up. I think the Speedway has been a great partner and a great location for getting us through the first 12 weeks of the vaccination process and getting us through the month of April. After that, I think we're going to probably build on our successes of what we did with some testing and some smaller events that are drive-through of nature and more mobile. So we're working on building that out, knowing that what I said a few minutes ago of getting into the community a little bit closer to where the need is, rather than down the street or down the state. So we want to do a little bit better matchmaking. So instead of doing 500 people a day, we'll probably have something where we do 500 to or instead of doing 5,000 a day, we'll have events where we do 500, 1,000, maybe 1,500, and do it in a place where we could set up quickly, efficiently get people through, and do it where it's makes sense to lower the risk for the state.
I would just add to that. AJ and I go back and forth on this question all the time. Just as a matter of math and numbers, you need some of those big clinics to move the big numbers through. And as allocation increases, as we expect it will, we're going to have some of those that we can fall back on. But the point is to get smaller clinics, more reliable, much like we do testing, as AJ said, more distributed across the state to be able to move the same number of vaccines.
All right, and second question, the kind of uptick in case rates recently, is that, I know you've talked about the frivolity around St. Patrick's Day weekend and the lack of attention to detail, you think. Is there any concern about people who are vaccinated maybe letting their guard down too early before they get fully vaccinated? Is there a way the state can track positive cases that might be occurring in those who are vaccinated but just haven't reached the fully vaccinated stage yet?
Yeah, I'll let Dr. Rattay respond kind of from a science point of view. But my own experience is there's a tremendous release. It's a sense of relief when you get that first vaccination. Whether or not that impacts your complacency or not, it probably does a little bit. And I think that's why our message has to be, and even beyond that, when you get fully vaccinated, how compliant are you going to be to mask wearing? And we know that there are situations we'll have to guide the public with that kind of information about what's safe to do and what's not safe to do as others are not vaccinated. And at what point, can you let your guard down a little bit? You have to be realistic because people aren't going to do what they think is unreasonable or doesn't make sense. And that's where it's hard, I think, to strike the balance. Right now, I think the appeal is, look, we've got this problem. We've got an uptick. Hang in there. Think about your neighbor. Think about your neighbor's business. Think about your favorite restaurant. And, it used to be, and still is to a certain extent, think about your grandmother, your elderly parent. My mother's 90 years old. My mother's vaccinated now. Chances are 70-some% of our seniors are vaccinated. So our concern has to be broader. We have to be realistic, I think, about what we're asking Delawareans to do so that they do it, because we rely almost entirely on voluntary compliance. And so we need folks to understand what we're asking them to do, why we're asking them to do it, make them think beyond just their own, household, and we can get through this. Dr. Rattay, that wasn't a very scientific answer. I'm sure you have a better one.
Not a lot to add, but I'll add a little bit about what we're doing with contact tracing. And we do ask these questions now. Have you been vaccinated? I don't have the numbers. We can get the numbers, but we do, find out if somebody's been vaccinated, when they were vaccinated, did they get 1 dose, 2 dose? So were they fully vaccinated? And we've had many people, both cases and contacts, who have been partially vaccinated and a couple who've been fully vaccinated. So I think that's an important point to remember as well, that there are people who've been fully vaccinated that do become positive. These are great vaccines. They are really great vaccines, especially around eliminating hospitalization and death. But it's not, a for sure thing that you're not going to get infected and you're not going to spread the infection, especially when there's still a fair amount of infection in the community. So while our numbers are much better than they were in December and January when they were really high, they're higher than we'd like to see them. And we are in a part of the country, especially where cases seem to be rising a little bit higher than in other places. And cases are rising all throughout the country. So, I mean, we all feel it. We all want to let down our guard right now. And, thank goodness that the weather's getting better, because being outdoors is so much safer. But between, the circulation of the variants and just that feeling that we all have where we want to let down our guard, it's just complicating things right now.
All right, next we'll go to Brandon Holbeck with the News Journal.
Hello. You've all kind of spoken about this a little bit, but I'm just curious, kind of what were the main driving factors behind making the move now to open up, or I guess next week, to open up to people 16 and older? Is it the increase in cases, the increase in supply? I'm sure all of these things factor to some extent, but what was kind of the driving force that let you know we can and we should do this now?
Yeah, I think it was a number of things. We've touched on each of them, and I'll start it off. One was just the friction in the existing system. So many limitations. People had to make judgments. Were you eligible? Weren't you eligible? Whether you can sign up, whether you couldn't sign up. Back in January, we could fill up a couple thousand appointment clinic in an hour or two, and now it takes several hours or a day or two, and you have to send out 10,000 invites to get 5,000 to accept the appointment. And so it was part of that. What we were hearing from other states and what we heard from the White House task force, and then of course the president. We were thinking about it before President Biden came out and directed all states to open up by May the 1st. We just, to achieve our goals of fast and fair, we just felt like we needed to open it up and open it up in such a way that we still provide some fidelity to our commitment to people with disabilities, to essential frontline workers. And as I said, at our clinics, over the last 2 weeks, we've done over 28,000 in those groups. We're protecting by vaccinating our restaurant workers and hospitality workers, our frontline workers in the towns and municipalities. And so, so those were the main factors, just to enable us to achieve our goals of fast and fair. To take, we had some difficulty who determines if somebody has a legitimate pre-existing condition? Who makes that evaluation? We obviously asked, and the primary care physicians and hospitals were good to do that for us. But again, mostly to achieve our goal of fast and fair. AJ, I know you were part of those conversations.
No, I think you summarized it well, and I think the best example is, everybody that signed up at the 50 and older list is going to have an appointment by the time, or have an email with the opportunity to get an appointment by the time we move on. So I think the timing is aligning at the right time for us.
And we always had the question from the beginning, Brandon, when do you open up? With the initial framework, 1A, 1C, 1B, 1C. When do you open it up to the next group? You don't want to open it up. You don't want to wait till everybody, all the people that, are putting it off, sign up. You want to keep enough flow so that you can move and fill up those appointments and not have vaccines sitting on shelves or sitting in and freezers.
With the COVID variants, you said we've had about 2 months or 8 weeks of surveillance so far. Has what we've seen aligned with what you thought was possible, or what you thought we would see as far as their spread to this point?
Dr. Rattay?
Yeah, Brandon, I would say it is, I think, what we've expected. In fact, I think the numbers look a little better than what I expected, that about 4% of our specimen are positive for variants. I suspect that that is likely to increase in the coming weeks. Hopefully not much, but it is something that the federal government is continued to warn us about. And so certainly we are going to keep a very close eye on that. The reality is, you prevent and you manage, these infections all the same. And, the vaccines that we have available to us, are very effective, especially against the UK, the California, and the New York variants that are being seen. So, we just got to keep on keeping on with mask wearing and getting people vaccinated as quickly as possible.
All right, last we have Nick Celino. Did you have any questions today?
Amy Cherry kind of asked my question a little bit earlier, but I guess I would just ask Governor in regards to choosing to not ease restrictions for indoor venues. What would your messaging be to Delaware business owners that are watching those restrictions eased a little bit quicker in neighboring states?
Yeah, my message is that, and I did talk to, as I said, Governor Hogan, and we watch what's happening in New Jersey and Pennsylvania. And then we just wanted to send a message that there's a little bit of caution necessary. I think they know that that it's difficult to achieve a capacity. We've had this conversation above 50% and maintain social distancing that's necessary in an indoor hospitality, restaurant, bar, et cetera. And that in the long run, it'll be better in the long run because we'll be able to get through this, more quickly get to a safer community as we get more people vaccinated and get indoor establishments opened up more fully. We've made progress so far, good progress. We're making incredible progress through the vaccination process. It is concerning that we've seen this upturn in new cases, sadly, frankly, and we're seeing also an increased circulation of folks, more traffic, more people out. We had the mayor's call as AJ referred to, and they're seeing lots more people in the beach communities, in the resort communities, up and around and circulating. And the risk involved in there, particularly if folks aren't wearing their mask. I think the people are being pretty compliant with mask wearing. And we'll continue to ask for those sacrifices so that we get to the place. But I think as a practical matter, there's not a lot of difference between where we are. There might be some difference psychologically, but in terms of how many people you can fit in an establishment compared to where we are in the states around us. And we'll continue to look at those numbers and make appropriate changes as we go forward.
All right, thank you. That's it for me.
All right, then. Thank you all for joining. Again, really exciting news for Delawareans. We're getting an increasing number of vaccines from the federal government available at your local pharmacy. Make sure you go there and get registered. Make sure you get registered on the state waiting list. It will open up for all Delawareans next Tuesday on the 6th. And take whenever an appointment is made available to you. Take that first appointment to get vaccinated. We need folks to sign up to fill those appointments in order to use the vaccines that are provided to our state. So thanks for joining us. Make sure when you're out circulating, wear your mask, protect your family and friends, and we'll get through this together. Thanks for joining us again today.